Your cat just gave birth to healthy kittens. She's nursing them, caring for them. Everything seems perfect. Then, a week later, she collapses in seizures and dies. No warning, no obvious cause. And the worst part, you might have triggered it yourself while trying to help her. Today, we're going to break down one of the most dangerous conditions that threatens nursing cats: eclampsia. You'll learn why this happens, how to recognize the first signs while there's still time, and exactly what you need to do to make sure your cat never goes through this. If you have a cat or you're planning to breed, this information could literally save her life. Let's get into it. Let's start with the basics. What exactly is happening inside your cat's body? Most owners think that once the cat has given birth and is nursing, the hard part is over. The delivery went fine, everyone's alive. Time to relax. This is a dangerous misconception. In reality, the highest risk period begins after birth. Eclampsia is a critical drop in blood calcium levels in a nursing cat. Vets also call this condition hypocalcemia or puerperal tetany. Calcium isn't just building material for bones. It's an element that muscles absolutely need to function properly. When calcium levels drop catastrophically, muscles start contracting uncontrollably. That's where the seizures, spasms, and respiratory failure come from. Remember this: eclampsia is an emergency. Without immediate veterinary care, your cat will die. Not in days, in hours. Now let's understand the mechanism. Where does this calcium deficiency actually come from? Many people think that if a cat is eating well, there can't be any problems. She's on quality food, everything should be fine. But that's not quite how it works. Here's the thing, kittens grow at an incredible rate. In the first weeks of life, their skeletons are forming right before your eyes, and all the calcium for that comes from mother's milk. Picture this: a cat nursing 5, 6, sometimes 8 kittens, each of them suckling calcium-rich milk several times a day. The mother's body keeps giving and giving this mineral, and at some point simply can't replenish the losses fast enough. It's like a bank account that's constantly being drained with no deposits coming in. Sooner or later, it goes into the red. Except here, we're not talking about money, we're talking about life. The solution starts with understanding. A large litter is a risk factor. If your cat gave birth to many kittens, you need to be especially vigilant. So when exactly do you need to be on high alert? Let's define the timeline. Many owners make the mistake of letting their guard down right after birth. A few days pass, the cat is eating, kittens are nursing, everyone's happy. Seems like the danger has passed. But the statistics tell a different story. Peak eclampsia occurs between the 1st and 4th week after birth. This is when lactation reaches its maximum. Kittens are growing, their demands are increasing, and the strain on the mother's body becomes critical. And it often happens suddenly. The cat was fine in the morning, and by evening, seizures. Your job is to stay vigilant for all 4 weeks. Better yet, the entire nursing period. Watch your cat every day. Any changes in behavior are a reason to be concerned. Not all cats are equally susceptible to this condition. There are factors that significantly increase the likelihood of eclampsia. A common mistake is thinking this only affects weak or sick animals. In reality, the most caring mothers are often the ones at greatest risk. Here's who is more susceptible to eclampsia. First, cats with large litters, 5 or more kittens. Second, young first-time mothers whose bodies haven't adapted to such demands yet. Third, small breed cats. They have smaller calcium reserves in their bones. And finally, overly devoted mothers, the ones who won't leave their kittens for a single minute forgetting to eat and rest. If your cat falls into even one of these categories, double your attention. If she falls into several, triple it. Now here's information that shocks most owners. What you think is helping could actually kill your cat. The logic seems bulletproof. If the problem is calcium deficiency, give more calcium. Buy supplements, give cottage cheese, milk. More is better, right? This is a catastrophic mistake. Here's how it actually works. The body has parathyroid glands. Their job is to monitor calcium levels and, when needed, trigger mechanisms to release calcium from bones. When you constantly give your cat excess calcium from external sources, these glands get lazy. They get used to calcium just showing up, and they stop working at full capacity. Then comes the moment when external sources can't keep up with lactation demands. The body urgently needs to mobilize its own reserves, but the parathyroid glands are asleep. They're not ready. and blood calcium levels plummet. So we get this terrible paradox. Your genuine desire to help your cat actually creates conditions for disaster. Never give calcium supplements without a vet's prescription. Never. If supplements are dangerous, then what should you do? How do you provide your cat with calcium the right way? The mistake is trying to balance the diet yourself using regular foods. Cottage cheese, fish, milk. It all sounds healthy, but you'll never get the proportions right. An excess of one mineral interferes with absorption of another. The scientific approach is simple: high-quality premium and super premium commercial cat food. Every micronutrient in these foods has been calibrated by specialists. The calcium to phosphorus ratio is perfectly balanced. There are special lines for pregnant and nursing cats. They account for the increased demands of this specific period. Your solution: switch your cat to this type of food from the start of pregnancy and continue throughout the entire nursing period. This is the foundation of prevention. Simple, reliable, proven. Now let's move on to recognizing the problem. Eclampsia develops rapidly, but it does have warning signs. Most owners miss the early signs because they're non-specific. Cat seems tired. Well, she's exhausted from nursing. Not eating much? Probably just not hungry. This attitude could cost her life. Here's what to watch for first. The cat becomes restless for no apparent reason. Or the opposite, unusually lethargic and apathetic. She loses interest in food even though a nursing mother should be eating a lot. Slight trembling appears. You can notice it if you look closely. The cat might walk strangely, as if uncomfortable, or frequently change positions. Any of these signs alone might mean nothing. But if you see several of them at once, that's a red flag. Don't wait. Call your vet. If the early signs are missed, the condition deteriorates like an avalanche. At this point, we're counting minutes. The mistake is hoping it'll pass on its own, or waiting until morning to go to the clinic. With acute eclampsia, morning might never come. Here's what full-blown eclampsia looks like. Muscle spasms become obvious. The cat may assume unnatural positions. Her body is tense. Breathing speeds up, becomes shallow and labored. If you look in her mouth, the gums are pale, almost white instead of healthy pink. Body temperature drops. The cat feels cold to the touch. Pulse slows down. Seizures begin. First individual muscle groups, then the whole body. The cat may lose consciousness. This condition is life-threatening. Without intravenous calcium, your cat will die. Your only correct action is to get her to a clinic immediately. Not in an hour, now. What can you do before you get to the vet? There are several critical steps. The most dangerous mistake is trying to inject calcium yourself. The internet is full of advice about calcium gluconate injections. Forget about it. Wrong dosage or injection speed that's too fast causes severe arrhythmia. Your cat's heart could simply stop in your hands. Here's what you actually can and should do. First, so. Immediately separate the kittens from their mother. This is critical. Every minute of nursing means additional calcium loss, which makes her condition worse. Put the kittens in a warm box with a heating pad separately. Second, call the veterinary clinic and tell them you're coming with suspected eclampsia. This allows them to prepare. Third, carefully wrap the cat in a blanket so she doesn't injure herself during seizures and get to the clinic. Don't waste time searching for information online. Don't try to treat her yourself. Just go. What will the vets do? Understanding the process will help you worry less and trust the professionals. Some owners worry that treatment is dangerous or painful for the cat. It's not. At the clinic, they'll give your cat calcium solution intravenously. This is done very slowly under constant heart rhythm monitoring. The doctor will watch her breathing and overall condition. If seizures are severe, they may prescribe anticonvulsants. Usually, improvement happens right before your eyes. Within minutes of starting the calcium infusion, the cat comes around. And here's the good news. With timely treatment, the prognosis is excellent. Cats recover quickly and without complications. The key word here is timely. The sooner you get her to the clinic, the better the outcome. The crisis has passed, the cat is okay. What's next? This period is just as important. The mistake is thinking that since the cat recovered, you can go back to the old routine. If you don't change the conditions, eclampsia can happen again. After discharge, the vet will prescribe oral calcium supplements. These need to be taken strictly according to schedule without missing doses or exceeding them. The kittens can't be immediately returned to their mother for full nursing. They need to be gradually transitioned to supplemental feeding. Special kitten milk replacers. This reduces the strain on the mother and gives her body a chance to recover. The post-crisis action plan should be developed together with your vet. They'll consider the kitten's age, the cat's condition, and other factors. Follow the recommendations exactly. This isn't a situation where you can improvise. The best treatment is prevention, and it starts with simple things that any owner can do. Many people think the cat knows how much to nurse her kittens. Nature is wise, it'll figure itself out. That's not entirely true. Maternal instinct can actually work against the cat herself. Here's an effective and simple method to reduce risks. Starting at the end of the first week of the kitten's lives, separate them from their mother for 1 to 2 hours several times a day. Do this under supervision. The kittens need to stay warm. During this time, the cat can calmly eat, drink, and rest. Her body gets a break and a chance to replenish losses. This simple technique significantly reduces the risk of eclampsia. It doesn't require medications, supplements, or special equipment. Just your attention and a little time. Beyond the routine, constant observation of your cat is critically important. The mistake is checking on the cat once a day and thinking that's enough. Her condition can change within hours. Make it a habit to assess your nursing cat's condition several times a day. Watch her behavior. Is she active? Does she leave the nest? Is she eating with appetite? Pay attention to her gait. Is there any stiffness or unsteadiness? Watch her breathing. It should be even and calm. Touch her. Her body should be warm. If something seems off to you, don't ignore that feeling. It's better to play it safe and call the vet than to miss the beginning of a problem. Your intuition plus knowledge is a powerful combination. A separate conversation needs to happen about cats who have already had eclampsia in the past. Some owners think that since the cat recovered once, her body has adapted. Next time will be easier. This is a dangerous misconception. In reality, if a cat has had eclampsia, the risk of it happening again in a subsequent pregnancy is significantly higher. The body doesn't become more resistant, and if anything, the opposite. So if you're planning to breed that cat again, definitely consult with a vet beforehand. A special pregnancy and lactation management plan may be needed, or the doctor may recommend not breeding at all. The same goes for cats with a history of very large litters. Each such pregnancy is a gamble, and the stakes are your cat's life. Let's summarize the most important point. With eclampsia, time is the one resource you can't get back. Owners often underestimate how fast this condition develops. It seems like there's always time to think, to consult someone, to wait until morning. With eclampsia, that time doesn't exist. From the first seizures to irreversible consequences can be just a few hours, sometimes less. Every minute of delay means lower chances of a good outcome. So your reaction needs to be automatic. Notice symptoms, separate the kittens, get to the clinic. No searching for information online. No calling friends for advice. No attempts at home treatment. Write down the phone number of your nearest 24-hour emergency vet clinic in advance. Keep it somewhere visible. You might need it in the middle of the night and you won't have time to search. So, let's put it all together. Eclampsia is a sudden drop in blood calcium in nursing cats, most often in the first 4 weeks after birth. The cause is massive calcium loss through milk. The paradox is that excess calcium supplements increase the risk rather than reduce it. Early symptoms are lethargy, loss of appetite, trembling. Acute symptoms are seizures, pale gums, breathing problems. First aid at home is to separate the kittens and immediately get to a clinic. Treatment is intravenous calcium under veterinary supervision. Prevention is quality nutrition, rest periods for the cat, and constant observation. Everything is connected. Proper nutrition before birth reduces risks. Observation lets you catch the problem early. Fast reaction saves lives. 3 pillars of your mother cat's health. Now a question for you. Has anyone you know, or you yourself, ever dealt with eclampsia in a cat? How did it turn out? Drop it in the comments. Your experience could help other pet owners. And if this video was helpful, share it with anyone who has cats. This information could save someone's pet. In the next video, we'll cover other dangers of the postpartum period in cats, things people usually don't warn you about. Subscribe so you don't miss it. See you then.